Okay, everyone, hello, and thank you for joining us today for our panel, Leveraging Technology to Innovate Healthcare Transportation, an overview of emerging technologies and best practices that improve member health and health plan experience. My name is Eric Glenn, and I'm Vice President of Business Development for Superior Health Plan, and I want to assure you we have a great panel lined up for you. And before we get started, I just want to make sure you all know that you can send us questions or comments at any time during the presentation in the chat box. I'll be monitoring those and ensuring that we get to your questions. And so without further ado, I'm going to kick it out to the West Coast. Let's all be mindful and thoughtful of our friends out there on the West Coast who are suffering from some pretty bad air quality. Andy, I know you're in California. Kathy, Madhavi, I know y'all are in Seattle. And so without further ado, I'll say, here's Andy.
Thanks, Eric. I really appreciate it. Thanks for the introduction. As Eric mentioned, I want this to be as conversational as possible. So please call things out, raise your hand in the chat window, ask us questions. May make sense to wait till the end to answer some, may make sense to answer some in the moment, but please feel free to call out any questions that you guys want to dig into deeper. So I'd like to start with some quick introductions so you know who we are, and then we'll give you some high-level introductions to our companies, SafeRide and Hopelink. So to begin, Hopelink folks, if you could just quickly offer introductions to who you are, and then I'll introduce myself, and then we'll get into the companies we represent. Susan, Madhavi?
Hello, I'm Susan Carter, Director of Non-Emergency Medical Transportation at Hopelink.
I'm Madhavi Lakamsani, and I'm the Director of Enterprise Applications for Hopelink.
Great, thanks guys. And my name's Andy Auerbach. I'm the Senior Vice President of Growth at SafeRide Health. And we're gonna be talking to you guys about technology today. So by way of introduction, SafeRide's a technology-first transportation solutions and technology company. And we've been working with Hopelink for a little over the last year to bring what we hope is a really innovative model to how technology can be applied to delivering healthcare transportation. Time flies. I can't believe it's already been over a year now, but we've been working really closely with Hopelink, who's a thought leader in the Medicaid and healthcare transportation space, to build out a technology platform that we hope can really serve as a model for how automation and innovation can deliver Medicaid and broader healthcare transportation in markets across the country. So we're really looking forward to sharing more about that with you guys today. And to begin, why don't we start with a little bit of background on Hopelink. So I'll pull up some slides, if you guys don't mind. And Hopelink folks, if you want to provide us over to you.
Yeah, so a bit about Hopelink and the Washington State Medicaid program. Washington is managed through the Healthcare Authority, a state-run agency. And through a bidding process, the Healthcare Authority contracted with 6 nonprofit agencies to broker transportation. It is a pass-through program, with each nonprofit receiving an admin rate to operate. Hopelink is one of the 6 nonprofits that the HCA contracted with, but non-emergency medical transportation is only one of the many services we provide. We have a network of services, including housing, financial assistance, food banks, family development, and more. Next slide.
Next slide, yes.
And Susan, just for everybody's benefit, how long have you guys been involved in transportation in the Seattle area?
Decades. We're 10 years into our current contract. That was a renewal contract that had lasted 10 years prior. I haven't been here since the start, but Hoplink's been around since 1971, so we're nearing our 50th anniversary.
Congratulations.
Thank you. So the Hopelink NEMT services King and Snohomish County, which is the 2 largest counties in our state, and has the highest volume of clients than any other Washington state broker. We also manage contracts with school districts as part of the McKinney-Vento Act and have partnerships with local hospitals to transport non-Medicaid clients. Over half of what we do is door-to-door service, where drivers actually sent to pick up a client. little under half is what we call lower mode. So that includes public transit or gas card reimbursement. In 2019, we served over 44,000 clients and provided over 1.5 million trips. We have a team of about 75. We contract with over 15 service providers that manage about 300 vehicles. And next slide. So to do this, we really have to have strong relationships in the community. And we have spent a great deal of effort developing partnerships with service providers that actually perform the service, hospitals and clinics, and with the healthcare authority. And as Andy was speaking to earlier, we have a lot of experience in this field. We have a lot of experience managing this program, understanding Medicaid processes, coverage, contracting with service providers, running a call center, and scheduling a high volume of trips. What one of our weaknesses is our software. And you can go next slide.
Yep.
And that is really where SafeRide came in.
Yeah, and thanks so much, dude. Like I said, guys, SafeRide's been working with Hopelink for a little over a year now. Where we were when we started was we'd built out a platform to connect everybody involved in delivering healthcare transportation, from state regulators to health plans, all the way down through the members that were receiving rides, bringing them into a single ecosystem so that we could then apply modern technology and automation to improve how transportation was delivered. There's a couple of basic pillars that we rest our program development on and we rest our technology development on. And that begins with reducing the high administrative costs of delivering healthcare transportation programs by replacing a lot of the legacy manual process with automation. Secondly, we aggregate supply networks into one single network. So as Hopelink mentioned a minute ago, they've got 15 plus service providers with over 300 vehicles combined. Now, previously, every single one of those different providers might run a different software application for routing and dispatching their vehicles. We bring all of those disparate providers into a single technology platform that allows us and allows Hopelink to dispatch effectively across the aggregated supply network instead of within 15 different silos. And that adds tremendous efficiency to the process. We allow both on-demand transportation for both rideshare and NEMT. In Washington State, rideshare is actually not an approved Medicaid transportation mode, so we're applying an on-demand model, or we will be applying an on-demand model with Hopelink in the future, using our technology to route NEMT vehicles in the same on-demand way that today you're used to routing rideshare vehicles. And the reason, of course, we're able to do that is because we're aggregating all suppliers into a single network, all of whom will eventually carry a SafeRide mobile application, allowing for dispatching to be done at the vehicle level instead of on the actual subcontractor level. We leverage proprietary algorithms for on-demand and scheduled ride dispatching, again, across the entire aggregated network, improving vehicle efficiency for every single mode of transportation delivered. We also bring transportation delivery closer to the point of need identification. So through our self-service tools that are available for both members as well as for care managers, we give the ability to schedule rides either in a clinical setting, in a call center setting, or for members directly, much closer to the point of need identification. So when need is identified by a care provider, by a health plan, they have the tools to schedule those rides right then and there, rather than forcing the member to then go through a series of other hurdles to schedule their own transportation. And lastly, and this is something that shouldn't be overlooked, when you have a single technology platform for delivering a transportation benefit, you ultimately improve the transparency and the data quality around network performance, cost, and member experience reporting. And I know that's something that's particularly important in Texas, given the transition that's about to occur. So with that, I'll hand it back over to Hopelink to talk a little bit more about the journey that they went on around this initiative and leveraging technology to modernize their approach.
Yeah, thank you, Andy. So we do currently have a technology, but it wasn't built for what we do. It's an off-the-shelf software that's really meant for a transit agency, and we've been trying to make it work for a brokerage model. And it's resulted in a lot of frustration, errors, quality issues, possibly even service failures. What we have has little data validation, so an agent is able to make an error, and there's nothing in the software preventing them from making that error. It puts a lot on them to remember little nuances. Also, updates that we have to do result in downtime. So imagine in 2020 having to take your software offline for 8 hours and do everything by paper. That's quite a bit of planning, frustration, upkeep, and the system's not intuitive. We spend almost a week just training people on how to use the software and not focus on customer service or the actual Medicaid program. And it's really impacting our service providers as well. They dedicate a lot of time to just data entry because they don't have that automated service. They don't have an app that enters in pickup times and drop-off times for them. It requires somebody to actually write it down on a manifest and somebody else to key it in. This is very costly for them. And next slide. Oh.
And one more, yes. So Andy, I don't know who's controlling the screens. I just want to say I just added animation. I'm sorry, I should have mentioned that. So, okay.
It's okay. That's my fault.
Okay, and we're on the next slide. Yep.
Yes. So this is Madhavi again. So we have heard Susan, as a business leader, talk about their strengths, weaknesses, and asking for a technology. We've also heard Andy talk about, not just Andy, their product company, they're going to deliver the technology which will help you deliver whatever you want. So specifically, my role comes into the picture where business users want X and technology is what they want. And technology leaders know how to build the technology. So my role was more towards the bridge. And what I would suggest for every organization before they choose a technology is to something called change management, trying to understand what is your one metrics that matters? What are your priorities? How do you connect the business with the technology, right? So that is where I come into the picture, where I have worked with the leadership at Hopelink to define the prioritization, because no software can come in like within 3 months, right? It's a journey. It's called software development life cycle. So what do you want? How do you deliver it? Your scoping, your prioritization comes into the picture, which is the main focus of my role. So now, going back, now this slide. The reason I've mentioned prioritizing technology and partnership is more towards understanding Hopelink's strengths and weaknesses. We wanted a technology partner who actually has a vision for future transportation, who are always on the emerging technologies. They're investing because that is not something the strength of our organization. And more importantly, a partner who realizes Hopelink's vision. So I did evaluate a lot of products, but mostly I would say our partnership with SafeRide, something we are very proud to mention, the way it's going very well for us is they are true partners and they actually helped our organization to specify, work with me on the prioritization and the delivery, and mostly understanding what are our P1s, how do we get into the compliance. And our one metrics which I keep talking about for our software is completing the trip booking within 3 minutes. right? So that is where our journey started with SafeRide. And I would say we are coming here to say we would like the goal of being the leader in the transportation business. And I would definitely say we have picked the leader in the technology industry, which is SafeRide. Yeah, we are very, very happy with them. So that's where it is. So Andy, we can move on.
Yeah, for us, it wasn't just purchasing something off the shelf as is and making it work. It's really finding a company that would partner with us, talk about what our needs are now and what our needs might be moving forward. So Washington State, we're not able to use a ride-sharing company now, but that doesn't mean it won't change in the future, and we want to be prepared for that.
Yeah, and if I could add, it goes both ways. You guys have been such a tremendous partner for us, because what we lack in knowledge of Medicaid transportation, you guys certainly didn't. And I think what was really important in what you mentioned was our software development process really began with understanding what you guys wanted Medicaid transportation to look like in 5 years. And we went through a pretty exhaustive journey mapping exercise where, our whole team, from executives down to our product team, went up to Seattle and sat in your call centers and sat with your leadership and sat with all of the different business units within your organization to understand what current state was, and then what a journey map future state would look like when we were delivering transportation 3, 4, 5 years from now. And that's been a really, really good guidepost for us as we've put the product roadmap together over the last year. And I think you guys have accelerated what we've been able to do from a technology perspective because of the thought leadership and the guidance that you've brought to us. So to echo the point, technology is only as good as the operational processes that it's designed to fix. And you guys have given us such clear vision for what we need to do from a development perspective.
Hey, Andy, Kathy, I just wanted to ask, it seems that prior to this, a lot of the areas of your operation were a lot more manual. How are you guys now sort of automating that through this project with SafeRide?
Many different ways. So I think the ones that really stand out to me are billing process. So earlier I mentioned there's a lot of room for error right now. There's nothing that prevents one of our agents from making a mistake or one of our service providers keying in a wrong time. Through using the app and the actual booking software, it'll prevent an agent from making an error. It'll prevent a service provider from making an error. So the data is really clean, and it's so much less effort for us and the people we contract with. Also, just looking at our call volumes, we expect to reduce the amount of calls that we get simply because a client or one of our agents can check on where a driver is easily. Right now, it's very manual. A client calls in, an agent takes that call, calls the service provider, that service provider checks in with the driver, and that communication then has to go the opposite direction back. These tend to be very lengthy calls, and there's no reason why we should get them if a client knows that their driver is 5 minutes away, if they get that text that says your driver's heading out there. So it's automating that. And we also have to look at what our service providers do. For us, they're small business owners. They don't have a lot of additional capital or funds for operations. Having to have a full-time employee just to data enter in pickup times and drop-off times isn't very cost-effective. And again, it's a high margin of error, or it could be. So by taking that off of them, they can then use those funds for other things, more drivers, other software outside of SafeRide. So we anticipate a lot of these manual processes we're doing now just becoming seamless and more of an afterthought and not something that we have to build report around reports around just to clean up.
Yeah. If I could just add one thing to that, a big aha moment for us that you taught us, Hopelink, was how stretched thin a lot of your vendors are, a lot of the transportation providers are. The prices have been compressed for decades in this market, and they don't operate with tremendously high margins. As such, it's very hard for them to make investments in things like new vehicles, in things like better routing technology and better dispatch technology, in better driver training. So one of the things that we chose to do was have a software model where all of the vendors in Hopelink's network have access for completely free to a dispatching and routing technology that is built in-house by SafeRide that helps them to achieve higher vehicle efficiency. And also, as Susan alluded to, cut down on any overhead right now that they have in building out claims, building out billing processes, doing data entry, et cetera. So we're actually focused on creating bigger margins within the current rates of reimbursement for all the subcontractors, so that they can then reinvest some of those dollars in tools that make them better transportation providers. And that was something that we realized pretty early on in this partnership that I think has really elevated what we're going to do.
Yeah, interesting.
Yeah, so some of our long-term goals through using SafeRide, we are going to be able to obtain real-time data, build some technical muscle. What we're using now is a bit of an outdated system. This is really going to catapult us into the future. It's going to allow for greater flexibility. I think COVID-19 is a good example. Lots of people having to VPN, having something that's cloud-based where we can just set up wherever there's internet access is going to be wonderful. And knowing that it's secure. And for us, it's not just these times. We're a 24/7 operation. Doesn't matter what the weather is like. If there's snow on the ground and people physically cannot get in, how are they going to continue to provide service? Having this set up where they can just easily log in is going to be just a game changer for us. And I think there's more on this slide.
Yes.
Yep, sorry.
Yep. And this goes back to that automatic system as opposed to manual. Earlier I said about half of what we do is public transit or gas reimbursement. Right now our agents are having to go to a third-party system to really understand what transit options are available for our clients. SafeRide was able to bring that into the software. So right there in the same system, our agents are able to identify if public transit is an option for this client, if there's a bus route near them, how much it's going to cost, and what buses they should take to get there. And they're able to communicate that right then and there, as opposed to later on. Right now, we have a separate team of people that go through and figure all this out, as opposed to right there on the phone call.
So here I would like to add the importance of the one metrics or the analytics I was talking about. So what Hopelink have prioritized is booking the trip within 3 minutes, right? Whatever Susan has talked about, the integration of Google Maps to understand the eligibility and whatever we were able to, because of the analytics, what we prioritize, we were able to go talk to SafeRide and say, hey, this is what our analytics or where we want to be. The first important, because of the booking the trip within 3 minutes is the most efficient way. It's actually the world-class customer service. So I just wanted to add that any organization which would like to work with the technology leader, have this type of metrics, understanding of your priorities, and understand what the software development lifecycle is all about.
Yeah.
Clients are going through a lot when they're seeking medical care, and transportation becoming a barrier might prevent them from seeking that medical care. So anything we can do to speed up the process, make it more streamlined for our clients, the more likely they're going to continue to seek the care that they need.
Yeah.
And let me ask Andy, Kathy, and Madhavi, kind of to that end there, as you're talking about that, and y'all are having to work through that change management. What are you doing with your employees to kind of up their skills that would help match, you know, a technology partner like SafeRide?
So this goes back to us. Oh, you can go ahead, Andy.
It's Susan, not Kathy.
Oh, Susan, sorry.
It's fine. This goes back to SafeRide not just being something that you buy off the shelf. So we've been in this process with SafeRide for a bit now. We're near launch, but we know what the product looks like because they've been giving us pieces to test as they've been developing it. So what we've been doing is taking those pieces and having our frontline staff actually get their hands on it, test it, learn the software, put in input, and then they can see that input later. It helps them feel valued. It helps them learn that software, and they're really excited by it. So when we actually launch, most of the teams are already going to know what to do, and they're going to have that experience in SafeRide.
And one of the things that, you know, you mentioned a minute ago, Susan, that I think is really important is that you guys are such a customer-centric organization that the metric we have been shooting for from the beginning is, can our team schedule rides in 3 minutes or less? So we've taken that as a challenge internally in our software development, and every bit of testing we do revolves around being able to ultimately achieve that metric. And so when we think about what a successful interaction looks like with a member who needs transportation, it's this. Determine eligibility of that member, and they receive transportation. Assess the correct mode of transportation for that member. Schedule the correct mode of transportation for that member or fund a mileage reimbursement. And then perhaps most importantly, advise them on how to most effectively connect with that mode of transportation. And I think the public transportation example is a great one in that there aren't any tools out there right now that allow you to schedule both an NEMT, a rideshare company, or public transportation directly through one platform. Not only that, but via our integration with Google Maps, we're giving their customer service reps the ability to advise the members if public transportation is the appropriate option, how to best access public transportation, where the closest bus stop is, where buses need to be changed, where trains can be accessed, where their cards will be funded, et cetera, et cetera. All of that will be in one platform, so it allows their customer service team to much more easily advise the members on most effectively utilizing that benefit. And I think that was most of what we had. Susan, Madhavi, any last items you guys want to add before we open it up to questions?
I think the one thing I want to highlight regarding our partnership with SafeRide is that it is an actual partnership. So they did come down with our team on several occasions for entire days, meet with our frontline staff, not just one, but several, and really understand what their challenges are, what their pain points are, hearing what clients believe our pain points are, and we can actually see that manifest in the pieces of software that we're getting now. So it wasn't just we're going to come down and listen. We're going to come down, we're going to listen, we're going to implement, and then we're going to see if it's what you're actually looking for. So that is really the partnership that we were hoping.
And one thing I would like to add is the organizational readiness. So, which I keep going back on understanding, you know, most of the customers understand, the organizations, they are very good at understanding the pain points. And you will have many, many, many pain points. So it is very important for an organization to have clarity, understanding what is that they are trying to do before, you know, I believe, you know, though SafeRide was here and helping us, a true partnership, we ourselves did a lot of homework on understanding our own scope, prioritization, how we are planning to do everything. Given the the system's complexity, which kind of helped, I believe, for the fast delivery of SafeRide as well, to help us test faster. So that, I would always say, the organizational readiness. We have a change management in place, have clarity on exactly what you need before you think about a certain technology or looking for a technology partner, exactly how Hopelink did.
Well, yeah. That is very interesting there. I appreciate that. Let me ask you guys, because I know that y'all have an innovative model in terms of how you are placing staff on site at care facilities in the region. Can you talk a little bit more about that?
Yes, so we have partnerships with 3 major hospitals in the King County area, Harborview, Seattle Children's, and University of Washington Medical Center, where we actually have one of our staff people on site. So they're at a desk in the main lobby, and their role is to screen clients to determine if they're a Medicaid client or not. If they are, they book that trip under a normal Medicaid process. If they're not, we'll continue to book that trip, but we're able to bill the hospital for it. And this has helped hospitals because they're not always sure if a client has Medicaid or not. So instead of having to call us or just paying for the transportation on their own, they're actually able to have somebody there screen. And it's also increased the turnaround time. So instead of having somebody waiting in the lobby for a ride, we have some dedicated service providers in the area, and we're able to get people out much quicker. This has really helped, especially in terms of discharging. So there's typically other people needing that bed, that space. They're able to arrange transportation as part of the discharge process and get them out much quickly. And SafeRide, going back to having a cloud-based system, we don't have to worry about somebody VPNing into a server here. They're able to just log on there, and it really speeds things up.
Yeah, that's it. It's sort of our broader goal is to, like I said up front, bring spectrum of transportation as close to the point of need identification, which often happens in a care setting, as much as we possibly can. So our ultimate vision is for there to be somebody in every care facility that when a member or a patient needs transportation, can look up the eligibility for that member, not just within Medicaid, but through any other transportation programs that exist in the region. So if they're not eligible for Medicaid transportation, maybe it shows that they are eligible for the hospital's transportation benefit. Or if they're not eligible for the hospital's transportation benefit, maybe there's another social services agency that will fund transportation for that. We want to aggregate all of the different funding sources for transportation as well in our platform so that we can get as many patients transportation as possible without creating a need for them to go to 3 different sources for 3 different transportation programs.
That sounds like that's going to be a definite time saver for everyone involved. I'm really interested in how Hopelink sort of worked through this process in terms of what you're going to have to do for the state. What were some of the things that were driving your concern? Because here in Texas, the MCOs are just now starting to take over management of this particular benefit. And I guess I would ask you, what as you guys, partnered with the state, what were some of the things that you were focused on, and what was most important to you in terms of being able to deliver those things?
Yeah, it's a lot of what we've already touched on, having accurate data. So if we do, not when or if, but when we do get an audit, that there's a lot of confidence around that data. And client satisfaction. I'm sure like every other broker, have metrics the state wants us to follow, not just in terms of call service level, but how long a client waits at a facility, how early that they arrive, how long they're on board a vehicle, knowing that there's a software that considers all of these metrics and schedules around that. They're also really looking forward to having a system where a client can schedule a ride or a facility can schedule a ride without having to be funneled into a call center. So access is a big topic with our state. We want to be sure that there's multiple ways a client can get a hold of us to seek the transportation that they need, with us still having the ability to screen that client appropriately. That's something that we lack now, but we'll be able to have with SafeRide. I will say the Healthcare Authority, when we talk to them about SafeRide, we are getting some questions. Can it do this? Can it do that? And it feels great to be able to say yes. And I know it's a yes because I've actually seen it. I can actually log on and see it now. So it's not just something that I think we'll be able to do or I hope we'll be able to do. I can confidently say, yes, we can do this.
Nice. Andy, you want to add anything to that?
Why would I? It was perfectly said.
Outstanding. Well, again, if there are any questions from those folks out there in the audience, we welcome those things. And you actually kind of, I guess, answered one of the things I was dealing with in terms of how HCA was viewing some of these changes that you all are having. Give us some ideas. You know, how did you guys really manage to meet some of these timelines, given in much the same way we in here in Texas, we're looking at a June 1 start date. You only had a year to kind of get all this stuff up or respond to that bid. Give us some idea how that worked out for you as well.
It's a lot of prioritization. So we really focused on that first year and on what are those things that we really need. How are we going to meet the requirements of the Healthcare Authority? How are we going to meet the expectations of clients? We really want it to be seamless for them. So the first year is focused on what do we need to do to get SafeRide up and going? And then moving forward, what are those added things? What are those things that are going to make lives for our clients easier? What are those things that are going to make things easier for hospital staff, for our own agents? So it's just a lot of prioritizing.
I would say prioritization of the customers, the clients calling in. That was number one. And also how the data quality, so the metrics is always, again, going back to 3 minutes, right? So the first year is always chasing that metric. How does booking a trip be done from 20 minutes? How can you bring it down from 20 to almost 3? So that is pretty much where I would say our team and we all sat down and we worked on our prioritization, giving the requirements to SafeRide and say, this is our first year priority. And that is where we also have in-house development where we lead a team where we are actually doing a lot of the gaps and everything so that we have a system which can actually go live. So a lot of back-end processes are handled by the in-house development as well.
Well, that's interesting. Andy, as we prepare to wrap this up, if you've got any last words, I'll let you have the last word there.
Yeah, I mean, any questions, obviously, from the group, happy to take as well. But I think what I'll leave you guys with is this. Don't be afraid to take some risks. Don't be afraid to try to innovate. Obviously, with the partnership with the Hopelink team, we've made some pretty big strides forward in areas that I think are perhaps a little bit scary for a lot of MCOs, knowing that at the end of the day, there was a lot that we did and a lot that we're still doing ahead of this launch. But, with close partnership, with a really strong implementation plan, with a really strong team like Hopelink has, I think we're really going to achieve a lot of the things that we set out to. So I would just say, don't be afraid to try to innovate. A lot of the things that perhaps existing programs have said can't be done, can be done. And feel free to challenge the status quo and think about, how a lot of the things that exist in other industries, probably it's time we apply them to NEMT. A lot of these principles of automation that we're doing have existed in the marketplace for 10 years, but have not yet made their way into transportation delivery. So I would just say, be fearless and don't be afraid to push things forward, perhaps a bit ahead of where your comfort zone is.
Well, good. And we do have a question that just came in, and I suspect it will be for Susan and Madhavi. Did the technology improve clients being able to make it to their appointments?
Well, we are still in the testing phase, but whatever we have tested so far, I would definitely say it has been the usability or whatever our goals are, it's been met.
Yes, so we are still testing,
Yeah.
but we're doing what I described as live testing. We're using actual data and we're running scenarios. And at this point, we're overly excited. It's going to really shorten the amount of time it's going to take for a client to schedule a ride. The algorithm that SafeRide came up with to efficiently schedule the ride amongst all those vehicles it was described as impressive by our scheduling team. So we anticipate yes.
Good, good, excellent then.
Maybe
Go ahead,
we'll all
Andy.
get back together so they can report the results.
Good. Well, maybe we'll see you guys again next year then. Well, with that being said, I want to thank everyone, all the attendees for joining us today. And thank you to all of our sponsors and all of the panelists. I want to say, I think day one here, we've had a great day. We've had a lot of speakers and presentations, and we're going to encourage everyone to just kind of keep this dialogue around the importance of transportation and healthcare, ongoing. And if any of the attendees would like to follow up directly with any of the presenters or the sponsors, please, you can use the app that you received that you got for your access, and that will get you in touch with these folks. The next TAHP Texas Covered Forum, Harnessing Innovation and Technology During and After COVID-19, is scheduled for September 24th, and it's going to focus on telehealth and other ways the healthcare industry is responding during these unprecedented times, and how advancements in the way we deliver healthcare will continue into the future. Thanks again, everyone. We appreciate you. We appreciate your time, and everyone have a great day.
Thank you, Eric.
Bet.
You too. Thank you.
Stay safe
Thanks,
out
guys.
west.
Thank you.
Thanks.